Hi, gua si Hilda Ong ko. Wakina o si Becca Ding Kang na chinchudin na ugi. 但是no ya 做囡仔個，咱同學知影，若有用叫做 autism 吧。你注意到用囡仔細漢個，伊目睭個無一當看，伊目睭無咧看你啦。所以你知影呐，這囡仔有偵查吧，還是就怎啊就創發落個，還是咱就叫做 ADHD 個。所以我即種咯，我無想到講咱start個。有安尼聽會叫做 vision therapy 那有我當醫囡仔啦，所以我今仔個我有叫咱的醫生個，那咱要講講，那這個要怎麼創發吧？那咱有這個囡仔那 autism 咯，有我當 correct 伊個目睭，para 伊 eye to eye contact 吧。sa 今仔個你這個個你若看到個我當講你我當。share ho pag katong la kasi sige tuy in ya o pangtsada. So wakina ko wakyaw Dr. Maya and Dr. Charlie. Ibe sige kaisa ko. Dr. Charlie, kasi kinasi ko ay tawtsipay ko lang si Bekang na chichon din chita ako. Chunga uwatang treat so ay gina na autism lo o ADHD lo. Sige, kumbaga habang ukaw puhe na ini kumbaga correct ba ini behavior.
Okay, so Nancy, Kang autism and ADHD.
Yes.
Actually, bo age lang, walang age.
Bo age siya.
We don't need it to be too young or too old. There's no limit actually. So for autism ko the usual problem is the sensory processing. Meaning the visual information, the hearing, the smell, tactile, taste. So I lots of information that reaches the brain, it has to be processed. So for autism, a case ko, because of too much information, they have problems trying to sort the information. Medyo process alin ang uunahin nilang i-process na information. Okay? So that there's too much information, they have problems sorting the information, then they have problems processing the information. Yun yung problem with autism. Now, if the autism, okay, because of the that nag-exhibit siya ng behavior na they could not concentrate, they could not focus. That's why they have eye contact issues. Okay, they are not looking at you straight in the eye when they're talking to you. They're looking at the ceiling, they're looking down, they're looking somewhere else because they have attention problems. They have focusing issues. Now, yung the condition of autism is sometimes exacerbated, meaning worsen na, behavior worsen because of an underlying vision problem. So, minsan, malabo yung kanilang mata that was not checked, di na-examine, hindi rin siya na-correct, or meron siyang misalignment sa eyes. Some are cross-eyed, mga iba banlag. Si Kyoche cross-eyed, exotropia. We call that strabismus. Some autism patients, meron din silang amblyopia or what we call lazy eye. So, even with the eyeglasses, vision ko si blurred pa din. Pero hindi niya alam kasi he has never experienced a perfect vision. And then the parents, the people around the patient, hindi rin nila alam because they don't understand what the patient is going through. They just think that, because the patient is classified as autism po. So parang accept na lang nila that kind of behavior should be acceptable. So little did they know na yung sa autism, pwede pang ma-improve yung kanilang behavior if you lessen their problems one by one. Okay, number one, if you are able to have their eyes checked, we can give them clear vision. Mas malinaw yung makikita niya sa surroundings niya, sa mga nababasa niya, sa mga pinapanood niya. Then his attention will also improve kasi naiintindihan na niya yung nakikita niya. Okay, number two, if common ang strabismus or the autism patient has strabismus, then he sees the world double. Okay? So, paano mo kukunin na ang glass of water kung dalawang glass of water ang nakikita mo? So, mangyayari, when you pick up the glass of water, sometimes if you pick it wrong, matatabig mo, matatapon yung, mababasag pa yung baso. And then, to us, we thought that, normal lang yan kasi may autism siya. So, hindi natin alam, karamihan sa atin, is that these things can be corrected. Yung kaniyang blurred vision, yung kaniyang doubling of vision, yung kaniyang misperception of distance. Kasi, imsaya ko, sige titulo, sabi outside. Or, he does not like outdoor activities. Ayaw niya mag-play sa labas ng bahay kasi he is poor in sports. He has eye-hand coordination problem. He has distance perception problem. So, ayaw na lang niya ng sports. So, what do? Sa bahay na lang ako, mag-gadgets na lang ako. You know? Because gadgets naman, for those with misalignment, they're only using one eye at a time. Kaya yung isang eye, lalong nagpumapasok or lalong lumalabas. Okay? So, these are common issues that if we are able to address, can further improve and modify the behavior of an autism or even a person with ADHD. But vision therapy is not the cure to autism. It is not the cure to ADHD. Vision therapy improves their functionality. Okay? You want them to be more productive? You make the environment seeable. Nakikita nila ng tama. You know? You give them the best possible vision. I-fix natin yung alignment ng eyes nila so that we can also fix their motor. Pag naayos natin yung kanilang motor, yung kanilang movement issues, yung kanilang balance issues, overall, he's going to develop as a person. So, lalo-lalo pag bata pa, mas maganda kasi he has more productive years.
Pagka ang magina na autism ko, tong siyang inibakchu, higit to siya, normal lang ba?
Di na si Chaputo less than 1 year old, first few months old, we are expected to have farsighted. To say 1C.
Oo.
Ngayon, di na si Gina ko before 18 years old, any age before 18 years old, di na si Kunsi or myopic or myopia, that is abnormal. That is abnormal. Kailangan ipacheck na yan. Kasi what we want to prevent is, kasi habang lumalaki yung bata, eyeball ko, nag-i-increase din yung length ng eyeball niya. So, tumataas yung grade ng myopia niya. So, what we want to prevent is, ito siya, mag-exceed ng 600. Kasi threshold ko is 600. Ang tawag na natin doon is high myopia. So, high myopia ko at an early age ko, it's possible early cataract, glaucoma, retinal detachment. Okay? And myopia, macular degeneration. All of these are blinding diseases that is connected with high myopia. Kaya lang ko, as early as possible, kailangan mapacheck natin siya just to rule out myopia. Ngayon, di na si Tio tanong, ano bang mga first signs sa mga bata o vision problem? O di academic din o buntuin. Kunyari, mahina siya. Ayaw niya magbasa. Okay, that's one, red flag na yan. Buhay, takse. Okay, penmanship. Hindi maganda yung penmanship niya. Minsan, paakyat. Minsan, pababa. Okay, may eye motor problem ka na. Diba? Inati classroom, lagi siyang tumatayo kasi gusto niya makita yung blackboard. Kasi ibig sabihin, blurred siya. Okay, let's na lang, classmate or seatmate, na lang yung sinusulat na kinokopya na lang. Minsan, pa. Diba? So, these are the telltale signs. These are red flags na the child needs an eye and vision exam. We're not just talking of eye exam, we're talking of vision exam. Kasi eye exam, eyeball lang. Vision exam ko, eyes and your brain connection. Yun ang matitest natin.
natin tulay ko ting namsikyaw iniyaya lo imami lo. So, para dito chua observe na betaya na kung ka sapoto baksu ubo hose lo. Imi chua saya.
Okay, other than hige appearance ko, look straight to the eye ko. Pag nakatingin siya sa'yo, okay, diretso, bubuntwe. Ngayon, baksu na squint, ganon. Ibig sabihin, hindi niya makita kaya exert effort ko para makita niya yung object lalo na kung malayo. Okay. Tapos usually clumsy din sa'yo, clumsy. Kasi iba tuwi mikya, asi takmay po ato. Asi di nalepe lao tuwi, minsan ma-calculate mo yung ano, madadapa ka. Asi di minsan pintuan, di ki long tiyogit pintuan, di ba? So these are telltale signs na bakchu ubuntu. Kasi hindi niya nakikita ng tama yung kanyang environment. Ibohan ang perceive why objects dito ba? Di ba? So we have to help them by doing examination.
哦，了即我即阵来直接答ako，即答即個所在是叫做 vision rehabilitation 個，唔是講要來遮就是要量看目眼角，還是你的目睭倒偌貴，還是偌低，還是近視，還是遠視個。即陣咱要愛知影個，像昨陣講有囡仔伊的目睭600度咯，要做甲伊 control 咯，那袂拄佇先啦。啊，了即陣啊，你來遮。你若講 rehabilitation 就是講start要按start，要創怎啊para 看到 improve 咯，到會好些咯。就俾咱頭前就是講，咱無愛伊愈久愈 grave 吧。可是咱即個兩目睭是第重要嘅啦。所以即就 Dr. Charlie，若是要來 start 咯個，所以是俾咱看到咱囡仔，所以要來 start 個，就是講恁若要甲伊 check。所以你話大概講因着確認就我創法吧，就從頭前你頭上你叫別人創啥
？Depende kung lan result of examination sa chua. So lan yo perform a lot of tests. So try exam, try test ko ho. These are not available in the regular optical.
Yes.
Kasi lan kung si basta optometry si optical. Etong bakya ba? No. So we do a lot of tests. So di na si autism, doktora o different tests for autism. For ADHD, doktora has a lot of tests for ADHD. Strabismus, cross-eyed, as a exotropia, we have a different test for that. Di na lazy eye, iba din yung test for that. So that's why we are very specialized. Ngayon, di na si kung di stroke, asi brain injury, kilong diyo, ki hospitalized, daw ki CT scan, tapos di ki kwa, no. Tapos di exhibit vision problem. But before the accident, wala ka naman na experience na problem. Like di balance issues. Then after the stroke, di balance issues. So di buwan na kaya straight lo. Di ba? Natutumba ka na. Kasi di alalay lo. Kasi di nalikya lo. Yung di body naka-slant sa isang side. You know? These are telltale signs. That's called visual midline syndrome. So lan try gadget ko naman yung prisms, lenses, kaya vision therapy and vision rehabilitation. Sige, try procedures ko ho that will train the brain. Kasi gusto natin ibalik yung mga skills na nawala because of the brain injury. Lan na kayo restore through therapy. So these are procedures that we do with the aid of machines, with the aid of technology, with the aid of lenses, and with the aid of prisms.
Doktora, so far siyempre din encounter to ato gina na autism lo, asi ADHD lo. Ina suindigay ko din chua kaya to ay gina ko kasi I'm sure yakang ko, di ba? So far out of how many patients din songelo ko to ay pebu after how long parang kwatyo inyahuahin na inkaya to improvement.
How do you approach yung ADS spectrum? What do you do? And then how do you anticipate the expectations of the parents?
So we start po explaining, no, right, before they start vision therapy, na it always depends, no, on the response of the brain. And we do every 3 months progress evaluation just to track the improvement. So vision therapy helps train the brain to communicate with the two eyes to work together as a team to improve their visual information processing. Because that's the most common among the behavioral issues of autism, ADHD. No, there's no eye contact or they have problem tracking. So once we address these vision problems, it can overcome the behavioral issues as well, no? Once you address and treat the vision problem through vision therapy. And you can see a tremendous behavioral modification and improvement in terms of their concentration, attention, even tantrums. We have a lot of patients that has ADHD, ASD, na nawala completely yung self-inflicted tantrums nila, injuries, and yung attention nila nag-improve din. And we have so many patients that started that they hate reading. And ngayon, as in sobrang ano na sila, bookworm na sila because they want to read na. And also, before therapy, they usually, yung mga introverts, they don't want to socialize. And after vision therapy, the parents can see a tremendous improvement na dun sa social skills nila. That they're willing to communicate with their kids.
Saka nag-interact na sila. Diba?
Yes. And their eye contact as well. So,
So, number one talaga yung eye contact eh.
Yes, because eye contact, it involves fixation. So, that's part of the eye movement, type of eye movement that vision therapy can help as well. So, like for example, I had a mother of a patient with autism who cried so much thanking us, na for the first time na nag-eye contact yung anak niya and nakapagsabi na, I love you, mama, na nakatingin na talaga sa kanya, na dati hindi talaga yan magawa. So,
pero mga how long bago na-achieve yung talagang gusto na isang magulang?
Yeah. It depends again, we can't really say the accurate na, okay, after 3 months ganito, because it depends on a lot of factors, but usually po, kapag may strabismus or special needs na case, it's really minimum of 1 year. But as early as 8 to 12 weeks, may makikita ka na talagang improvement dun sa visual skills nila. Yes.
So, pagka ganyan, doktora, kahit anong edad, kaya pa?
Yes. At any age, we can help, because vision therapy, the principle behind vision therapy is neuroplasticity. So neuroplasticity is the brain's ability to rewire, reconnect, make new connections, through learning and training. So at any age, vision therapy can help treat the vision problems of patients.
So, doktor, pag kasi din akong vision therapy, to see P lang, to see to light sita.
Yes. So lan clinic facility nang accommodate kasi lan try special equipment. So we require at least once a week to lan facility para lawan ang ingnan try newest technology. Now at the same time why buhan ng like clinic ko guno virtual online therapy. And then it is also combined with home therapy. So lan try set of tools na kyo patient tuwa-toki. Tapos doon nila gagawin sa bahay yung mga activities. So we combine from clinic, home, tapos meron tayong online. Kasi lang online so is best to guide the patients throughout the therapy. Para pag nasa bahay siya, tama yung ginagawa niya.
So, longchong therapy si yachoy kwa ni, di ba? So, di le kwa din ulit chong hui chong chi kwa mi kia na di zai kwa to kwa an tolo ka mahina o in the bakshu in the brain.
Yes. So let's say diagnostic test. Okay? So lan diagnostic test so usually it takes about an hour and a half to complete ganun katagal kasi lang yacho test na gagawin. Because we want to be careful, we want to be sure na saan talaga yung area yung problem area so we can make the proper interventions.
So far din na pasyente, din nalay kahit chong sige therapy loko. Itay pasyente uli sunod o higit tiyaga na talaga inay kung kwato improvement.
Actually, the longer they stay sa therapy, mas gusto pa nila. They're improving. Mas lalo nila na-accept yung therapy. So, because they can feel the improvement already on themselves. So, pag nakikita nila yung improvement, mas gusto pa nilang ituloy-tuloy pa, para to further improve. Because iwan ang experience, sige, change lang.
Dito sa chichu, yung lalo na gina, di ba? Tongso gina o ay lazy eye lo, asi cross eye lo, lang siyo choy duling lo, asi bakcho diamle lo. Higi, what ang correct?
Yes. Regardless of age, kasi usually din na cross eye ko, minsan baby pa lang or minsan congenital. Okay? But there's no such as congenital, sabi nga nila. Usually, first few weeks, minsan mag-exhibit na yung cross-eye. So, yun, that is common. So, pwede pa nating yan, without surgery. We can align the eyes without surgery. Yung mga eyes naman na lumalabas, kasi banlag, okay, ganun din, no? Mas madali actually yung case na yun. So, we can still align them without surgery.
So, 我見到你就是你家己，我見到嚟打個，我感覺這個我當班長也最難。我嗰時頭先講過，先俾人看人，那我當避免手術吧。Number one 係先啦，無愛手術吧。所以咱即陣個就是有這個叫做 vision therapy 個rehabilitation 個。所以我見啊是無管什麼嘢知個，kahit na 40-50歲哦。這個你目睭無好勢，這個我當 correct 啦，是講你就照醫生講過，你就是就來做 therapy 咯。And then 有做了之後有一個一提起出來創咯個，pero so far 再來做創嘅個，大家也歡喜，大家kumbaga ini bakju hege lalo na try wala kanin try gina kasi lang chito no siya si chin try gina o autism as o ADHD ko so kung siya tao chang to sila stop si bepo din like chita vision rehabilitation sige si chita Chicha West Avenue Quezon City dia why got tade why happy
Left and right, okay? Ready, set, go. Good job. High five. High five. Good job. Other hands are red, right? Good.
Three, 4, 5, 6.
Very good.
Yeah.
Health and Travel at Serbisyo Publiko. Serbisyo Publiko with Dr. Hilda C. Ong. Ang programang tunay na serbisyo publiko na nakakatouch ng puso. Health and Travel at Serbisyo Publiko. Ang programang tunay na serbisyo publiko na nakakatouch ng puso.